The fight against the spread of Lassa fever has been in the front burner for government and healthcare providers in Ondo State. But the challenge of testing samples has been a Herculean task. As part of ways of bridging this gap, the Institute of Human Virology Nigeria, IHVN, provided this state-of-the-art equipment to support the existing molecular laboratory in Akure, with the optimization efforts of the state government and the Nigeria Center for Disease Control, NCDC. The epidemiology and surveillance manager for the institutes, Dr. Saiki Musa, noted that due to the increased cases of Lassa fever outbreak, the institute is collaborating to provide modern equipment for carrying out diagnostic tests in the state capital.
In 2023, we were here to establish some gaps in the control of Lassa fever, and that included, amongst others, the fact that there is a need to establish another public health laboratory to complement the effort in FMC Owo. The state took it as a duty to decentralize this testing opportunity, and IHVN, through the funding from CDC, United States Centers for Disease Control and Prevention, took on this effort to support the facility with some equipment that will complement what already exists. And some of these equipments are the ones we've mentioned: the chemistry auto-analyzer, hematology auto-analyzer, the safety cabinets, and we have also tried to certify some of the existing equipment.
Permanent Secretary, Ondo State Ministry of Health, Dr. Adeniran Ikumola, commended the collaborative efforts of the institute, adding that the equipment will be properly utilized.
We want to especially appreciate Mr. Governor for providing the enabling environment for partners to collaborate with us. We have here now, we have inspected the equipment related to us by CDC, and that is the Federal Ministry of Health through NCDC, and then facilitated by IHVN. We went through their multi-million equipment that will assist us to strengthen our public health laboratory towards testing for Lassa fever and other infectious diseases.
Representatives of both the Nigeria Center for Disease Control, NCDC, and the World Health Organization, WHO, commended the initiative, assuring of more collaborations.
Currently, we have 13 labs within the network. This lab here at IDH is now one of the labs as well that we are looking forward to optimize in the nearest future, pending some modifications that have already been made. But we've also sent some equipment, we've also sent a team, right? We've also conducted some level of training for them, but then we'll still do more with regards to, in preparation to optimize the lab, to make it functional, to be able to test for Lassa fever, especially, which is in focus at the moment.
The lab here will help us to be able to identify cases of Lassa fever on time, and that will reduce case fatality, and it will improve the system and response by both the state and partners.
The provision of this equipment is expected to revolutionize the fight against Lassa fever and other emerging infectious diseases. Pius, OSRC News.